Ebola is apparently back, and it's already in the United States. There are 350 suspected cases globally, 91 suspected deaths as of recording, no vaccines, and officials say that the outbreak is bigger than we even think. And so right now, you have the World Health Organization declaring an Ebola outbreak in the Democratic Republic of Congo and Uganda as a global health emergency. And as far as in the US, reports say that at least 6 people have been exposed to the virus. One of those is confirmed, and 3 others are said to have high-risk contact or exposure. And diving into the specifics, the suspected cases and deaths that we've seen so far are linked to an Ebola strain called Bundibugyo. It first popped up in a 2007 outbreak, infecting 149 people, killing 37. The next time we then saw it was in 2012 when it infected 57 and killed 29. And so this appears to only be the 3rd time that we're dealing with this rare strain, and we're looking at a fatality rate of around 30 to 50%. And on top of that, it appears you can have the virus for weeks before you start showing symptoms. And while you aren't usually contagious up until that point, the early symptoms like fatigue or fever, they're easy to write off as something else. And so there are concerns that a lot of damage could be done to spread it before you realize what it is. And so that ends up being one of the reasons why officials say that the numbers that we've seen so far, they might not even tell the full story. And the timing here, it could be better is one way I'd put it. Global health agencies are still recovering from COVID. Funding battles could backfire on us here in the United States. And all of that is trust in public health institutions is deeply fractured. But now officials have put a level 4 travel advisory in place for the DRC and Uganda while they try to get Americans there to safe quarantine locations. One source even said that they could be moving to a US military base in Germany, but that hasn't been confirmed yet. Right, and while the CDC wouldn't answer any direct questions about the patient with symptoms that reports have mentioned, they said that the overall risk for Americans was low, with them stressing that they did not expect this to be some second coming of some pandemic. But still, you have some scientists worried that even if the immediate risk is low, the bigger concern is just how weak the US's response systems have become. Or for this or something else, I mean, since last year, the US has backed out of the World Health Organization, cut funding from the US Agency for International Development, right, USAID, and cut a lot of funding for the CDC. You also had Elon Musk and his Doge bros accidentally cutting 4 out of 5 USAID contracts related to Ebola. And while he said that his team corrected that immediately with no interruption, when it was all said and done, 1.6 out of the $2.2 million set aside for Ebola prevention, it was cut. And even back then, you had officials concerned, saying that it was going to have an impact on the groups meant to prepare us for moments like this.
As the WHO has tried to address this, 2 important phenomena have happened. One is they've had to downsize considerably, meaning that there are less resources available to support countries around the world with technical assistance. There's less resources for data monitoring for potential threats such as pandemics, emerging disease threats. There's less resources for helping to support supply chains. All of those direct impacts of the financial consequences of our withdrawal are real.
Or to put it in other words, with these cuts, we just don't have the people or the resources in place to track, predict, prevent, or manage these types of outbreaks for ourselves or the countries that we used to help. And we also know that because this is not the first time since we've made those cuts that things have gotten sketchy. Or when another Ebola outbreak hit Uganda in early 2025 without US support, the president of the Uganda Medical Association said they were notably less prepared and responsive. They didn't even have the money to get enough protective gear for the medical workers trying to save lives, which meant that a lot of them just had to bow out of helping for their own safety. So with that, you had him saying with no USAID money and CDC expertise, it was like Uganda was left to die. And again, you have to look at the bigger picture here because Uganda is just one example. The Ebola outbreak is just one virus. Even with other recent outbreaks like the ongoing hantavirus situation, there is a growing concern that health systems are being tested on multiple fronts at once. And depending on where in the world these diseases and viruses hit, that could leave millions of people defenseless.
As countries no longer have access to support their health systems, we are starting to see them disintegrate. We are seeing those impacts in very real terms right now. There's an estimated over 750,000 excess deaths that will occur this year because of these changes, most of those in children.
And so we have yet another preventable virus spreading because the people in charge of the systems designed to catch it were kicked out of their offices. It's why you had one expert saying it is really unusual for an Ebola outbreak to get to this scale before being detected, particularly in DRC, which is a lot of Ebola experience. But without the resources to put that expertise to use, now the whole world has to be put on notice, and none of this had to happen. From last year's outbreak to what we're seeing now, the people who have died, their lives could have been saved if the US kept supporting the agencies that were doing the work. And what I'll add to this is something that I'm worried about with like all these situations is that if a few of these things, they spread and you see it pop up in the news, there's a lot of concern, but then it kind of fizzles out. It may end up lulling a big part of the population into kind of a sense of complacency of, oh, well, we're probably fine enough. When something eventually comes around that's like that first wave of COVID and we're just not prepared, that it's gonna fucking crush us. And even that might be skipping the step of being worried about what we're seeing now and looking more towards the future already, like maybe a little bit too early, I don't know. But hey, time will tell, and of course, every death we see in the meantime, it's another example of you may not fuck with politics, but politics will fuck with you.